here you will find all the things you need to create your Homeobotanical blend. I call them HBs for short. So here you have all your HB stock bottles, and they can fit inside a plastic container like this. And what that does, it just helps you to organise it all. You've got the alphabetical sequence and you've got that numerical sequence as well. Here you have some tissues, which are really helpful if you spill anything. They're also really good if you need to wipe your treatment bottle. They can get a little bit sticky, or you can spill some of the base liquid as you pour in there perhaps. They're just really good to make sure that your treatment bottle is nice and clear so you can stick the label on there easily. These are the base liquids. So you've got two options. We've got an alcohol-based one here and we've got a non-alcohol-based one here. So they're both 1 litre bottles, and the alcohol ratio is 500 ml of filtered water and 500 ml of just plain vodka. The non-alcoholic base liquid is 200 ml of apple cider vinegar, 400 ml of water and 400 ml of glycerine. Here you've got your treatment bottle, which is a 25 ml dropper bottle. You've got your syringe here, which is in 5 ml increments, so you can accurately measure from the stock bottles into the treatment bottle. And here's the label. So this is what you're basing your HB recipe from. So we've got 3 ml of A for allergy, 2 ml of K for kidney, and they'll be going into the 25 ml dropper bottle. So here's how that happens. So I like to move the dropper out of the way and making sure that this stem doesn't touch anything. So anywhere that you can do that, light down on this tissue here, then it's not touching the bench. And make sure you wash your hands before you go ahead to make your treatment bottle, and remember that hygiene is really important here. So A for allergy and K for kidney. So give these a little bit of a shake too, because what can happen if they've been sitting here, some of the herbal residue can settle, and you want to make sure you've got an even distribution throughout the liquid there. So 3 ml of A, giving that a shake. Now I can see in here there's not a lot of liquid in there, so my syringe isn't going to reach in there to draw it out. So what I'm going to do is I'm going to pour that into another container so that I can get that out. So up to 3 ml, that won't quite fit. But here's a good example of what happens if you get an air bubble in there. So just hold it up so you can see. So I can easily get 2 ml. So I'm just going to push that down until I've got 2 ml of solution there, and I can put that into my treatment bottle. 2 ml. So we need 3 ml of A. So I've got another one over here that we can use to make up the rest of that 3 ml total that we'll put in of A. Now this is a new bottle of the stock bottle. It hasn't been opened yet, and what I like to do when I get these is to succuss them. So remember, succussion is potentization. That's what makes them effective. That's what gives them that herbal energy. So I like to succuss the stock bottle because it's been in transit, it's been sitting, and it just helps to revive the herbs in there. Cool, so we need 1 more ml of A. Now when your stock bottle is full, it's a lot easier to draw out the liquid. So see this gap in the label? That's a really good visual for you. So you can put your syringe in there and see how much you're drawing up. So that's about 1 ml. And we'll pop that into the treatment bottle. Always like to put the lids on between, because you can often accidentally bump those. Now I'm going to use the alcohol base for this client. Now I'm going to ignore the measurements on here. I'm not going to measure the second part of the base putting the base in there. It's not necessary, and it would save you a little bit of time. Now, rinsing the syringe in between using the two different stock bottles, this is a really easy way you can do this. So I've poured the base liquid into the beaker, and what I'm going to do now is draw up that liquid, which is rinsing my syringe, and I'm just going to squirt it into there. Now, the next one is K for kidney. So we've got 2 mils that we need to put into the blend here. So I've given it a shake, and I'm turning it around so I can see the gap where I can draw up from. So we've got about 2 mils. Oh, just about got a bit of air in there, so we'll get a bit extra up. 2 mils into the treatment bottle. And again, rinsing the syringe, drawing up and putting into the treatment bottle. Now this is the part why I say you don't need to measure anything, because what we'll be doing is we're just going to pour the base liquid into the treatment bottle here up until it reaches this curve in the bottle, the shoulder of the bottle. And the reason we stop there is because we need to leave some room for potentization, for that succussion action. And also what will happen is, because when you put the dropper bottle in there, you'll displace some of that liquid and the fluid will move up, and it could overflow outside the treatment bottle there. So just pouring in, using your eyes to get it up to that curve, and then placing the dropper bottle in there, the dropper lid. Now, some of these lids are lockable, so you want to tighten that on until you can hear a click. Tie it on nice and tight. This is where I'll give it a wipe. And now we can succuss our treatment bottle. So at least 40 times you want to do that, and that just helps bring it all together, make it that herbal energy. Now, putting the label on the bottle is the next thing. So a simple way you can do this, rather than plonk it on in the middle and it gets all crooked and air bubbly, if you put it on the side there, line that up nice and straight, and then press around, and the label will just flow on your bottle nice and smooth. And there you go. So we'll go ahead and make another one so you can see what that process looks like again. Here's the recipe we'll be using. So we have Z for zest, so we've got 2 mils of Z, L for liver, 1 mil, number 19 Serena, 2 mils. So that makes up your 5 mils of the stock bottles, the Homeobotanical blends that will go into the treatment bottle. So we get all those out, get everything ready, Z, liver, and number 19. So 2 mils of Z. So I like to start at the beginning of my recipe and work my way through it, so I know I'm doing it in sequence. So I get everything out first, and then when I've put my 2 mils of Z into the treatment bottle, I will then pop it away so that I don't get confused if I get interrupted, and I won't double up on anything. So giving that a bit of a shake. And drawing up 2 mils. Into the treatment bottle. Put the lid on my bottle and pop that away. So in my beaker I've got the base liquid, so I'm going to rinse my syringe. So just drawing up and squirting that liquid into the treatment bottle. That would go in there anyway. So now 2 mils of, 1 mil, sorry, of liver. So I'm tilting the bottle so I can get that into the syringe. There we go, 1 mil. And rinsing the syringe into the treatment bottle. 19 Serena. So we want 2 mils, drawing up and into the treatment bottle. And again, we'll rinse the syringe. Just an efficient way to make sure that you're making the most of your time, and remembering you're probably going to have your client in clinic while you're creating this, so you want to make the most of their time as well and make that process as efficient as possible. So here we are again, we'll be pouring the base liquid into the treatment bottle up to that shoulder. So just using your iometer, just looking at that to see about there's about right. And then we can put the dropper lid in there. Now if you were adding flower essences to your Homeobotanical, making yourself a potion or your client a potion, then this is the point at which you would add those flower essences into the Homeobotanical. So lid on, if it's a lockable cap, making it click, giving your bottle a wipe, and then we'll place that label on. So again, line up the side, pop that around, and succuss your Homeobotanical. And there you have it.